Hello, I am Harland Harrison. I want to close Sequoia Healthcare District. Vote for Harland Harrison and Lois Garcia for District Directors. You can find us at closeshd.com. Sequoia Healthcare District started as a hospital district to build and run Sequoia Hospital. Then the directors sold the hospital but went right on collecting the taxes. They got $11 million last year with no hospital to subsidize. Let's get rid of this district. Its purpose is gone. Now, in all fairness, the directors do not want to sell Sequoia Hospital, but after they lost $29 million in 1 year, the voters passed Measure H to order them to sell it. But it gets worse. The first thing the directors tried was selling the hospital back to themselves. They sold Sequoia Hospital to a shell corporation they controlled with half the seats on its board. The grand jury investigated and found it inappropriate to collect taxes for a purpose the voters never intended, and that what the board told the voters, well, was not exactly right. Eventually, the district had to transfer all of the Sequoia assets to Dignity Health, known then as Catholic Healthcare West. But it gets worse. Since the district now has no hospital, their payroll is much smaller. They have 3 or 4 employees, some part-time, yet the CEO still gets paid $250,000 per year, just like somebody running a major hospital. But it gets worse. Part of that final transfer was a profit-sharing agreement from the hospital owners back to the district. Now, Dignity Health is a large nonprofit. It operates about 40 hospitals and has Catholic nuns on its board. How can you share the profit of a nonprofit? Well, accountants devised an EBITDA formula, sort of a derivative. Start with a margin, add back in the interest, amortization, depreciation, subtract 9.3% ROI threshold for return on investment, and that's the total take. And you give half of the take to the Sequoia Healthcare District Board. So now the district formed to subsidize low-cost hospital care is raising the cost of Sequoia Hospital by extracting its own profit. One of our opponents says the EBITDA has failed because some years has not paid anything, and last year it paid $375K, I believe. One of our opponents says that. The other opponent helped negotiate the deal. But the board has the word of Goldman Sachs. Yes, the word of the same company selling the toxic mortgage-backed securities of the housing bubble. Goldman Sachs assured the board the EBITDA agreement was worth millions. This EBITDA is like a cross between a derivative stock option and a timeshare. Let's just get rid of it, sell the EBITDA, or turn it into an honest loan, and replace the people who negotiated it. Now, if we stop collecting district taxes, property tax bills will go down a few dollars. The taxes are a share of the 1% ad valorem limited by Prop 13. So if we close the district, the money will go to schools, fire stations, cities, and San Mateo County. Now, my opponent says the county and cities would not have to spend this money on health care. They could spend it on sewers, she said. Well, sewers are very important to public health. But the district did not have to spend its money on health care either. In fact, often it does not. One of the board's favorite charities is Meals on Wheels. I know it is a favorite because the majority not only votes money for it, they even volunteer to help. Now, Meals on Wheels is a worthy charity, but it is not health care. It's lunch. Hot meal for mom, check that she is okay. Meals on Wheels works all over the country, but they just ask for donations, whether there is a health care district or not. I have my favorite charities too. Support Amnesty International and the ACLU. But I would never think of diverting your tax money to my favorite charities. Now, the grants the district makes could do great things, but the good things might not be for the good people of the district. Consider scholarships for 44 nursing students over the years. Half of the nurses wound up working in the area, half didn't. 9 went to Palm Springs. Certain charities even agree to earmark district funds for district residents. Okay, but should the food bank turn hungry people away? Sorry, these beans aren't for you. You don't live in Sequoia Healthcare District. And then what resident would ever think of saying to food bank, no, I gave through the healthcare district? Absurd. We do not need Sequoia Healthcare District. Vote for Lois Garcia and Harland Harrison. Together we can clean up the mess and close down the district. Garcia and Harrison for Sequoia Healthcare District. Find us at closeshd.com.
Ladies and gentlemen, I am Kathleen Kane, and I am running for re-election to the Board of Directors of the Sequoia Healthcare District. Since the district no longer owns the hospital, voters asked, where do our tax dollars go? What role does the district now play in the delivery of healthcare to our community? The answer is simple. The Sequoia Healthcare District uses 100% of the tax dollars on costs for health services to our community residents. The programs that the district supports with these tax dollars provide services to thousands of district residents per year, many of them among the most vulnerable, the aged, youth, and the uninsured and underinsured individuals and families. In the past, we initiated a partnership with Samaritan House to open and manage a free health clinic. This clinic is currently operated with volunteer physicians, dentists, nurses, and other staff. They provide primary and specialty medical, dental, and vision care to low-income and uninsured individuals. They also operate a free food pharmacy, which supplies healthy food to those suffering from diabetes and other conditions. Through our signature Health Safe program, the district has financed life-saving equipment at more than 340 locations within our district. This equipment includes automatic external defibrillators and Lucas devices that are used for sudden cardiac arrest. Thanks to the Sequoia Healthcare District, all our police and fire department vehicles are equipped with life-saving devices, and to date, they have saved many lives. Additionally, we provided CPR training or arranged for training for thousands of our residents. Our Healthy School Initiative invests in an average of $3 million annually to help fund school nurses, counselors, physical education coaches, and wellness coordinators to all our 28,000 public school students. The district, through our Caring Community program, provides funding to 5013C organization. This year, $2.1 million was given to these charitable organizations for health services. We created a unique registered nursing education program. A partnership was formed between Kenyatta College, San Francisco State University, and Sequoia Hospital to educate and address the shortage of registered nurses in our community. The district underwrites this satellite program at Kenyatta for $1 million per year. Since its inception, more than 400 students became registered nurses, and the majority work locally. The district is prudent with your dollars. All of the $11 million collected in property taxes each year is spent on health programs, all $11 million. Many of our residents that we help with these tax dollars may not be aware or familiar with Sequoia Healthcare District and what we stand for and do. We may never meet them personally. However, as a board member, I am confident and assured that their lives, and especially their health, is improved because of the existence of the district. So please vote for me, Kathleen Kane, and Kim Griffin to represent you on the Sequoia Healthcare District Board of Directors so the district can continue its vital work to assure a healthy community. Thank you.
My name is Kim Griffin. I am running as an incumbent for the Sequoia Healthcare District Board. There is an extraordinary amount of work and responsibility involved in being a healthcare district board member. But I found while the work is difficult and time-consuming, it is also immensely gratifying to be involved in providing oversight to community health programs that are not only beneficial to the health of our district residents, but end up being cost-effective as well. As a registered nurse, I know the health services we provide in schools, clinics, and to the elderly population enhance the quality of lives and add significant measures of preventative health care that offset more costly health problems if left untreated or ignored. Two of my opponents, Ms. Garcia and Mr. Harrison, are running for board positions with the intent to dissolve the district. They failed to explain the taxes for the district will continue to be collected and incorporated into the general tax fund if the district is dissolved. We need leadership in local government that is willing to work hard and not merely show up at a board meeting to make a negative impact on programs that have a proven track record by saving lives and keeping our community healthy. A vote for me will be a vote for maintaining a healthcare district that benefits everyone in the community. And please support my fellow board member, Kane, who is also running as an incumbent. Thank you for your support.
My name is Lois Garcia. I'm asking you to vote for me for the Sequoia Healthcare District Board of Directors. The healthcare district is, in a word, unhealthy. It was originally formed to build a hospital. That hospital was Sequoia Hospital in Redwood City, my hometown. For this purpose, the people of San Mateo County supported a ballot measure for creation of the district and agreed to allow the district to take a portion of the 1% property tax. The district no longer owns, maintains, or operates Sequoia Hospital or any hospital. The hospital was sold in 1997. After the sale, the district could have dissolved, returning the property taxes to school districts, fire districts, and other county agencies. Instead, the hospital district became a healthcare district without voter approval. They continued to collect tax revenue and at one point had accumulated cash reserves of over $41 million. The district is a government entity, not a foundation, and not a private nonprofit. Yet, all of the money that was intended for a hospital is now redistributed by the Sequoia Healthcare District to charities and programs of their own choosing, projected at $10.2 million for fiscal year 2015-2016. These donations and grants are not subject to voter approval. The district CEO makes $250,000 a year. There are no shareholders to which the CEO is held accountable. The district enjoys a profit-sharing deal with the hospital, in addition to the taxes they collect. The district also has the power to invoke eminent domain, to take someone's property without their consent and without the approval of the community. The only citizen oversight for the Sequoia Healthcare District is the San Mateo County Civil Grand Jury. The Civil Grand Jury is an independent investigative body created by the California State Constitution. Composed of 19 citizens, the jury serves as a watchdog for citizens of the county. The grand jury's purpose is to be the conscience of the community. In 2000-2001, the grand jury recommended that the district reduce property taxes for district taxpayers. The recommendation was not followed. In 2001-2002, the grand jury recommended that the district correct misinformation previously disseminated to the public. In 2004-2005, the grand jury investigated over 20 different districts in San Mateo County. Only the activities of the Sequoia Healthcare District warranted their own special report. That report recommended that Sequoia immediately pursue merging with the Peninsula Healthcare District. This would save our communities the overhead of 2 different districts with 2 sets of salaries and 2 sets of benefits. The recommendation was not followed. In 2008-2009, the grand jury again recommended that the district decline a share of its property tax revenue and enhance community input and involvement. That recommendation was not followed. In 2012, the grand jury noted that districts wield considerable influence with little oversight. Looking over its history, the Sequoia Healthcare District has done some good, but there isn't much accountability. In fact, in 2002, they wanted to tear down Sequoia Hospital. If not for one dissenting board member, Jack Hickey, who brought the issue to the voters with a petition referendum, we would not have the great hospital in Redwood City that we have today. The Sequoia Healthcare District has a duty to serve the community with integrity. They need a strong board of directors to make tough decisions and who won't be swayed by ties to the healthcare industry. I want to join Jack Hickey on the board as a voice of the people. Please vote for me and for Harland Harrison for the Sequoia Healthcare District Board of Directors.